Okay, perfect. All righty. Megan, did you
Okay.
have a question? Or were you just looking because you wanted to remind me of the time? Because I was
I
wondering.
was just, I was very glad that they had that new no age limit, because a lot of people, like I know with us, we couldn't get ABA. Medicaid wouldn't cover it, or I couldn't find a facility that would cover it. And if they can get it at a later age, I think that's, that's important. So I'm glad that there's things being done about these.
Yeah, ABA kind of got a reputation for only being for children, just mainly because of early intensive intervention and all of the attention that was paid to that in terms of getting health insurance coverage, so that these children could get access to therapy, and it was, considered to be most effective. But ABA actually was developed for adults first with intellectual and developmental disabilities, and its techniques were used really with adults first. And then as that evolved, the Lovaas Institute started using it with younger and younger children to specifically treat autism. And that was kind of where it, really got more noticed, I should say, and it really got parents interested in trying to get it covered for their children. But it's a science and a treatment and an intervention that has never been targeted just for autism and never been targeted just for small children or young children. It's basically effective with anyone with a face because it's really, it could be used to treat anxiety. It could be used to treat several different mental health conditions, but it's just really been popularized by treating autism. And so that's kind of where the attention goes. But we hope to advocate for kind of what we term ABA for all, which is basically we'd love to continue to do advocacy and show the efficacy of behavioral intervention and have it something that is accessible to all those with developmental disabilities, intellectual disabilities, autism, anxiety, other appropriate mental health conditions at any age if they choose to do so. And so that's kind of the long game in terms of advocacy and ABA therapy and ABA interventions on the medical and mental health side.
Yeah, because I know a lot of the parents that I know, I mean, you do have additional behaviors and things that happen in puberty. So that definitely needs, like,
yes.
Woo, like
especially for girls. I think they're finding that especially for girls, it's something that crops up. Those and seizures, unfortunately, yes.
Yeah.
Two big things to watch for. Yeah.
Mm-hmm. If a family needs guidance to navigate the insurance and Medicaid part of ABA, they would come to you. You're the person that they would go to. Okay.
Yeah.
And then do you sit down with them and you kind of talk about how do you work that when a family comes to you?
Sure. Usually what we do is the first thing we have to do is play 20 questions, because I have to figure out what kind of health plan they have.
Okay.
Because that then helps us figure out what laws apply and what regulations apply, and then what's the best strategy for getting the coverage. Sometimes I also have them send me a link or a copy of their actual plan language, because then I kind of know what I'm looking for. And so then I can go through it very quickly and find different language that gives me an indication about which laws and regulations are applying, and then what's kind of the best route to use that plan language to convince the plan that they are supposed to be covering ABA and autism treatment if they're having trouble accessing that. I also do a lot of consultation with providers on multiple families who are having similar issues to kind of try to help the most people, I can with the time that I'm able to work. So I do a lot over email just because I need to see those documents and things like that. So it's really helpful when families contact me by email, but I also take phone calls and, kind of walk them through the process as well with that. So
Are you
Is there
really
a
busy?
charge for that?
Oh, good question.
Yeah.
The ARC of Indiana does not charge families for any advocacy work that we do. The only thing that the ARC of Indiana charges families for are certain things with our trust department that we're required by law to charge for. But our advocacy work is always free of charge to families. We don't charge them for that. That's why I work for them. I just didn't want, to put any more burden on families than they already have. And since they had a nice process set up for giving families free advocacy help, that really spoke to me. And so that's why I'm there.
I'm getting sidetracked now. So Megan, please feel free to center me as well. So like, I know you have a family advocacy department as well. Are you part of it? Do you work together? What's the structure? So if they go to you, how does that look?
Yeah, our family advocacy team all work together, and we meet every week to talk about what we're all working on, what kind of cases we're getting, but we are in constant communication with each other. So like yesterday, I got a phone call from a family and there were some insurance issues, but there were also some trust issues, and there were the Miller trust issues, and there were also some nursing home and, figuring waivers out and how that interacts with the nursing home kind of issue. So I am not as well versed on nursing homes as one of my colleagues. And so I called her. We had a little call, and then I was able to call the family back and get them the information that they need. So we're constantly conferring with each other because we all have a little bit different specialization. And we want to make sure that we give families the most up-to-date and accurate information we possibly can. And we're constantly learning too, and constantly having to update as well. And, but we do our absolute very best to make sure that what we're telling families has been vetted. And, and if we don't know if something is, if we don't know something, we'll go find out with the right people, from the right organization or part of the state. And so we help each other keep up to date on that kind of thing as well. Yeah. Because there's just between Medicaid waivers, private insurance, the Affordable Care Act, all the different systems, education systems that we all have to interact with as families who have loved ones with special needs. It's just so impossible to know every ins and out of every single thing. So we work together to make sure that we can get the best information out to families.
Now, what kind of collaboration do you do with, because here's kind of just what I'm thinking with schools, because if they knew, I'm thinking from the beginning when they first get a young child in there, do they okay, so I'm talking about it, but what kind of collaboration do you do? Because I don't know if schools know everything you do, and the help that families could get from you from the very beginning.
Yeah. We, our communication director has kind of a listserv that she sends information out to. And so any school can contact us and get on that, our newsletters, our website, they can definitely access that as well. And then we also work a lot with other organizations. Autism specific wise, one I'll mention, we work with Autism Society of Indiana quite a bit. We work with the Indiana Resource Center for Autism and Dr. Pratt, who also works very closely with all of the schools and their autism specialists. And so we try to make those connections and work with the folks who are working with the schools, and also schools directly if they would like us to. I've gone to several school districts to give presentations to parents. Of course, that was pre-COVID, that was in person, but we're doing a lot of that via Zoom as well. And all
I'm not sure if you can hear me right now. My Wi-Fi might have frozen a little bit, so I'm gonna hang in there and hope you're still being recorded appropriately.